I would say public health nursing,
Is really looking at the whole person.
you make a huge difference. You're serving underserved populations.
Public health nurses have a huge opportunity to grow in their career.
Look into public health. If you want the clinic experience, public health has it, but it also is dealing with the community. It's about relationship. I was able to build relationships with families, provide education, and see change. When you're in the hospital, you don't get to see that same level of change. You can start breastfeeding with a mom on the night shift. When I come back the next night, she's gone. In public health, I've been able to stay with families from 18 to 24 months.
And I think I can see the direct impact more than I would in other certain types of jobs. And it's more of preventative work, which I really appreciate. Working in other settings as a nurse, you kind of are on the opposite end where you're helping people once they get sick, and I'm more in it to help people prevent themselves from getting sick and getting certain diseases.
I just love the ability to help another person. And with tuberculosis, it's a disease that is very curable. So it's one of the areas in nursing where you see progress and where you see that people do get better.
Work-life balance, it's completely different. You don't have to work holidays, you don't have to work weekends, you don't have to work nights and evening shifts.
Most other nursing jobs require you to work every other weekend, and that's a major thing, especially if you have a family and you have kids that need to be home.
We have what's called a flex schedule. And so I actually just had a baby last year, and so I had a ton of appointments for prenatal care. I haven't had to miss out on a lot of my daughter's milestones because I have the flexibility to take that time off.
I've done a lot of policy work that it's like, who would have thought that as a nurse, you're able to bring about policy change.
There's research, there's epidemiology, there are nurses at many different levels of the state, local government.
There's home visiting, there's, STD work, communicable disease work, reproductive health. There's so many areas that you can go into once you work in public health. If you're interested in public health nursing, do your research, look it up, see what it's all about, call your local public health department and see if you can speak with a nurse there.
The county gives you great benefits. I know you're young, but consider retirement and what that means.
I would strongly recommend becoming a public health nurse. It is just such a rewarding experience working in a strong team, feeling supported by the county, feeling supported by a great manager.
Whatever you think you might be missing by coming into community health, you're not. Community health affords you a lot more opportunities for self-growth and self-development and really make a difference collectively.